Again, I'm speaking with Kurt Merriman. He is with RT Now. That is a leading telehealth provider that offers a new way of doing respiratory therapy health care and doing some screenings. Tell me what people would do. Do they contact you, or are you just about linking healthcare providers?
More just linking healthcare providers. So our services, we would be working with the healthcare providers, the organization, and help them in a couple different ways. One is we could provide them with technology so that they could connect their staff with their patients, whether they're in their home or whatever location it might be, to gain access to a healthcare provider with a telehealth solution or a telerespiratory solution. Or we could provide our services with our licensed respiratory therapists.
With your background in respiratory therapy, what are you hearing about the coronavirus that maybe the general public isn't?
From everything I've read from these reliable sources, CDC, is that we're very early on in this newly declared pandemic. The data is just unfolding as we speak. Some of the main things that we can really do is you may be infected by it, but if we stick to some of the basic philosophies of doing what makes common sense, of minimizing the exposure that could be there.
You're coming together with, what, 1,000 respiratory therapists tomorrow through technology, and what is it that you're going to be talking about?
Kind of the effects of COVID-19 for our respiratory therapy profession, what we can do as professionals, working as frontline individuals that are seeing these patients, and then wrapping it all together with how we can look at telerespiratory as a means of, again, helping to mitigate exposure, helping to gain access to professional healthcare individuals that can help screen patients before they actually may need to come in.
Well, the more you all know, because you are the experts when it comes to respiratory health, and this is a respiratory virus, the better off the rest of us are, because the more we know about this, the more we can get a handle on it. So, Kurt, thank you.
Oh, thank you so very much for having me. I appreciate it.